Jonathan in Atlanta. Dr. Kevin Campbell on all of this. They came our consulting president, CEO, kind of health physician, cardiologist. Doctor, very good to have you. What do you make of, first off, the variants and that are popping up in states like Florida and elsewhere? People always hear that sort of thing and they worry about whether the vaccines can address so many of them. What do you think?
Well, variants are just in the nature of a virus itself. The virus mutates to survive, and these are what the variants are. And the great thing about the vaccine thus far, for most of the variants we're seeing in the United States, it is still effective for that. That's something we'll have to study over time. And, just like the flu vaccine changes over time, I suspect our COVID vaccines will adapt to the variants as we move forward.
I'm wondering, too, whether the variants concern you. I mean, I don't know the history of this and other types of flus and all of that, but this is, I understand, different. Should we be worrying about the sheer number of variants popping up? It's gotten so bad in Europe, for example, that some countries like Italy are revisiting lockdowns, a slower than expected go of it in distribution of vaccines as people are getting anxious. So what do you think?
I think that the key is vaccinating as many people as possible. And as we develop this immunity as a herd, as we like to say, I think we will also be able to continue to evolve immunity to the variants. What we're seeing from the variants is they're a little more transmissible, but they don't seem to be more deadly. They don't seem to be related to higher rates of hospitalization. So the key is vaccinating and creating herd immunity. And I think that's going to be the most important thing we can do.
How do you think we're doing on all of this, Doctor, and where we're going and the light at the end of the proverbial tunnel, and whether the late spring, early summer is going to be, when the great economy opens up and when people can start taking their masks off? Or how do you see it? What's the timeline?
I think, as President Biden has said, he said that he's going to have vaccines available for every American by the end of May. If that is certainly true, if that really happens, and we get more than 85% of the population inoculated, I think we're going to quickly see herd immunity. And once we do that, if we follow the science, as we have all been told we need to do, we should be able to remove masks and things like that, in the months following that inoculation of that number of people. I think we're going to finally get back to normal.
Doctor, stubborn plurality of Americans in particular who are leery of vaccines for whatever reason. And then this news about AstraZeneca that it may have included out-of-date data in its own vaccine trials. Never mind that present-day trials are looking very, very promising. People are saying, aha, this is why I'm leery. These things happen. They're not the silver bullet. What do you tell them?
I think these new messenger RNA vaccines, which is what we see with Moderna and Pfizer, these are vaccines that are much easier to produce and they're much safer. The myths are they actually come into your body. They don't enter the nucleus. They don't interact with your DNA, but they carry instructions to the cell, and they tell the cell to make antibody or make proteins that look like the COVID virus, and then we create antibodies and T-cell immunity to these. So they're very, very safe. They're very, very effective. And I think that, with the recent stuff that came out with the vaccine, the AstraZeneca vaccine, what we see there is probably just some poor science. I was trained that if you torture the data long enough, it'll confess to anything, and garbage in equals garbage out. We need to be meticulous in our clinical trials. And I think so far we have been in all the other vaccines that I've seen on the market today.
That's very, very good to hear. Dr. Kevin Campbell, thank you, sir, very much.
Thank you, sir.